I hear every day from older people and their families who are struggling to get home care or a place in a nursing home. Clare has the longest home support waiting list per person in the country. Even though the government are spending more on home support nationally, Clare is not getting its fair share. This needs to be fixed so waiting times can be brought down quickly. Because of this, more people are going into nursing homes, unfortunately. But nursing homes in Clare are also under severe pressure. Private and voluntary homes, which provide most of the beds in rural counties like Clare, are facing real financial problems. The Fair Deal rate doesn't match the rising costs of care, unfortunately, and smaller rural homes are struggling the most. People in Clare are stuck with a problem. There are not enough carers to let them stay at home, and there aren't enough nursing home beds, unfortunately, available for those people to go into. Families are under huge pressure. People in Clare want to grow old at home where possible and have dignified care in nursing home when the time comes. The government has the power and the vision to make that happen. I am asking that Clare is not left behind. Will the Taoiseach commit to a plan to increase home support into counties like Clare, where waiting lists are the longest, and putting serious pressure on families? And will he commit to providing support for existing rural nursing homes so they can cope with the rise in demand and encourage new entrants into the market to ensure there are enough beds into the future? Thank you, Taoiseach.
Taoiseach, please.
And thank you very much, Deputy, for raising this very important issue. It is fair to say that we are ageing as a society. Our lifespan has improved dramatically from 20 years ago, so Irish lifespan has increased more than most in the European Union, which is a good thing for all of us, potentially. On the other hand, it creates more challenges in terms of care costs, health costs, and so on. And so every year there are substantial increases in the budget as we try and provide for an ageing population. And so the budget for home support in 2026 is the largest ever at 914 million, and that's an increase of over 87% from 2020. And that gives you an illustration of how services are expanding to meet an ageing population, a population where we're living longer, and so forth. Now that investment will see additional support and complex home support hours. We'll increase it by approximately about 26.7 million hours. 26.7 million hours. That will support about 62,000 people by the year end. In Clare and the Limerick County Integrated Healthcare Area, in 2025, 1.38 million hours of home support were delivered, and that exceeded the target of 1.35 million hours. And that represented an increase of over 500,000 since 2024, just 2 years ago. That's a massive increase in the number of hours that we are providing. But you are correct in that there are still challenges. I think there's about 694 on the waiting list for Clare and Limerick County. That's an integrated, that's so they counted within that area. Waiting on home support services, down from 748. There has been an issue with recruitment because the service has expanded so much that there has been a challenge in recruiting home carers. And there's been a lot of external overseas recruitment initiatives undertaken by the HSE and others and private providers endeavouring to get more in, and that's an international challenge. There is a strategic workforce advisory group on home carers, and that's working with the Department of Health on exploring options. We're also using assistive technology in home support initiatives in order to directly address rural home support provision. And the Home Support Providers Bill legislation has passed the second stage. That will improve the regulation of the sector. More importantly, it's the first step in ensuring that home care will be provided in the context of a statutory home care scheme. We're also providing additional funding to Meals on Wheels, about 3.3 million a year of Meals on Wheels will be provided. 313 day centres will be resourced to support nearly 16,000 people in 2026. And then the Fair Deal scheme, I can take that maybe in the next
Deputy Cooney
supplementary
to
question.
respond, please.
Thank you, Taoiseach. Clare is a county with one of the fastest growing older populations, and providing serious challenges for those elderly people is very important. Its rural nature and the remoteness of many areas are especially challenging to provide home help to older people given the travelling distance. Also, support for more home help and nursing homes in Clare would help in a big way the overcrowding situation in UHL. And I'm aware of families that have been told people that's in the hospital could have to travel 30, 40 and 50 miles to get a home help bed, which is not good, a nursing home bed, which is not good enough for them families and them people. It is a serious concern, it is a serious issue in our county, and I'm calling here today, it needs to be addressed. We're a rural county and we have serious problems as regards elderly and nursing homes and home help.
Thank you, Deputy Taoiseach.
Well, I fully appreciate your advocacy for your home county of Clare, and just to say, I mean, in terms of home care, day care, Meals on Wheels, very significant extended resources, all working together, and they're particularly effective in rural areas, and particularly in County Clare as well. I'm sure you'll agree. What you need is additional resources, is what you're advocating for here. The Fair Deal scheme supports people to access nursing home care. The more you have, I suppose, the more you pay in terms of income levels, and it's structured that way. The less you have, the less you pay. But again, it's huge costs involved here. There's about 24,000 people now involved in that scheme. 80% supported in private homes, nursing homes, the remainder in HSE-run facilities. And it's gone from 968 million to 1.2 billion now in 2025. So that will continue to rise. And I take your point in terms of the need to try and improve that, to give people access closer to home. That's accepted. But people generally want to stay as homes for as long as they possibly can. There comes a stage, I accept, when a nursing home is required. And obviously, the closer to the family home for the family, the better.
Thank you, Taoiseach.
In those situations.
Now we move straight to questions.